So let's talk about warts. Now, there are many different types of warts, and they're all caused by the human papilloma virus. And there are two that you can treat at your local pharmacy, the common wart and a plantar wart. Now, the common wart most people would recognise. It's normally on the back of your fingers, and around your knees, and then around your toes. And then there's a plantar wart. Now, your plantar wart's normally on the base of your foot. It's perfectly normally circular, it's flat, and it's got cauliflower type looking in the middle of it all. Now, what treatment options do we have available? Well, we have some liquids available that contain salicylic acid and lactic acid. Now, they both soften and dissolve the skin. Now, it doesn't know if you're putting it on the wart or normal skin, so always protect that normal skin or it'll just start dissolving away at that as well. Then you've got wart off that contains podophyllin. Now, podophyllin kills skin cells that may contain the virus that is causing the wart to occur. Now, these kind of treatments take about 4 to 6 weeks to work, depending on the size of the wart, and they can go a blacky-browny colour in that process. We also have some freezing options available now as well, which basically contain a canister and an applicator. So you plug the applicator into the canister, load it for the desired time as per instructions, then you place obviously the cold tip onto the wart, again for the desired time as per instructions, and then remove. It can work as one applicator. Sometimes it can take a couple of goes before it will knock the wart on the head. Within 2 weeks, we normally get a result with these guys, so it's a little bit faster than the creams. Now, who should see the doctor? Well, if you're pregnant or you have diabetes, you should be seeing a doctor before using any of these types of products. Again, if you have warts that keep reoccurring, if you have genital warts, or if you have a wart on your face, again, that's all doctor territory. They have some things that they can obviously prescribe and some things they may be able to do in-house in the surgery. But in general, if you have a common wart or a plantar wart, you should be able to talk to your local pharmacist about some treatment options to get rid of those warts for you. So a great way to put on wart cream is to use a cotton tip. With one end we put a protective barrier like Vaseline, which goes on the skin around the wart. The other end we put the wart cream itself on and can dab it directly onto the wart. That way we don't dissolve the skin in and around the wart, and we don't dissolve our fingertip in the process either.